Could you just start off by introducing yourself?
Yeah. So my name is Bob Lutz. I am the Spokane County Health Officer.
And how long have you been the Spokane County Health Officer?
I was appointed this role summer back in June of 2017. So 3 years, a couple odd months, and a couple of odd days.
And I imagine your job has changed a lot from when you started to 2020.
Yeah, just a tad. Yeah, I mean, you know, being the health officer is like being a family medicine physician, which is what my training is. You have to be responsible for a lot of things. Um, since the pandemic began, this is sort of very time consuming. It's sort of all things COVID. So yeah, so it's changed pretty significantly. And you and I are talking virtually
Yeah,
versus meeting in person. So yet another example of how life has changed for all of us.
absolutely. Yeah, my dad's actually a family medicine
Oh,
physician.
is he? Okay. Locally or elsewhere?
In Marysville area.
Oh, okay. Okay. Yeah, I know Marysville. We used to do in another life, I did program evaluation work for school districts, and Marysville was one of the school districts I spent a couple of years in. So yeah, it's a
Oh,
nice place.
cool.
Yeah, nice place.
That's cool. Yeah. So I guess with regard to coronavirus, how would you say at this point in time that Spokane is doing?
Well, I mean, if you were to just look at our numbers, Summer, you would say not well. We've had a significant uptick in our cases dating back to at least Labor Day, if not a little bit before. Our incidence rate at one point was significantly higher than other counties in the state, especially counties of our size. Again, if I were to compare ourselves, for example, to Western Washington counties of comparable size, our rates are significantly worse. And I was talking with my colleague in Yakima County, and as you know, Yakima County was one of the most heavily impacted counties. And their incidence rate means the number of cases, and we measure it over 2 weeks. So the number of new cases over 2 weeks, their incidence rate is about 1/3 of ours right now. So we're not we're not doing well.
And are we slowly increasing right now?
Yes and no. I mean, it's been holding steady around the 220 to 240 range. Yesterday, we were about 241 over 2 weeks. And so we've been again in that 220 range for a good couple of weeks, unfortunately.
Yeah. And do you guys have data yet on kind of what age groups you're seeing the most
Oh, yes.
cases
Oh,
in?
yes. Oh, yes. What age group do you think, Summer?
I'm gonna guess mine.
I'm going to guess you're between the ages of 20 and 29.
Yes.
Then you would be guessing correctly. Yeah. If I just pull up, and again, if you're not familiar with our website, if you just go to srhd.org, you can look and just go into the COVID data and you'll see. But as of yesterday, Summer, the 20 to 29-year age group represents a full quarter of our cases overall. And if I just go back, for example, I mentioned, let's just take it back to, like September 1st as an example. And you can, again, you can look at it and get your own data and take a look at that. But if I look at it from, say the end of August, beginning of September, yeah, I mean, it's been hovering pretty consistently between, 22, 25%. So anywhere between a fifth and a quarter of our cases on a regular basis are accounted for by people between the ages of 20 and 29.
Yeah. And what do you guys have any explanations for that? Is it our age group going out to bars and eating and drinking or being in school, or what are your thoughts?
What are your thoughts, Summer?
I would imagine just ignoring the gathering guidelines probably would be
Yeah.
my first guess.
Yeah, I think that's right on, Summer. There's something called pandemic fatigue. And when we've done with Kelly Hawkins, who you contacted, she did some work with young people. And again, common comments were that this is inconvenient. Um, we're tired of it. We're over it. We want to live our lives, and it doesn't impact us that badly. And therefore, we want to do what we like to do, which is hang out and socialize. And I get it. Unfortunately, when young people your age get it, i.e., COVID-19, they can transmit it to family members if they're living at home. They transmit it to older individuals. And so, what we typically see after big spikes in cases is that we see older age groups contracting COVID-19. And as you know, COVID-19 does not do well if you're in an older age group with respect to how it impacts you. So your symptoms may be more significant. So yeah, you answered it correctly. That's right. That's why.
Do you think that more young people, 20 to 29, need to be getting tested due to the fact that so many people can be asymptomatic?
I mean, yes and no. I would, if if we had if we had a testing capacity somewhere that allowed me to routinely test what we call surveillance, or to be testing more often people, then I think, yes, I would definitely be pushing for that. It's estimated that between 40 and 45% of individuals who have the infection COVID-19 actually have no symptoms. And so that has been the reason why COVID-19 has been so difficult to handle and get in front of, because so many people are asymptomatic, meaning without symptoms. And if those individuals without symptoms are not following the behavior guidance, then they can infect others. And I think one of the lessons learned is that COVID-19 is very behavior sensitive. It takes advantage of misbehaviors and does not do well when people behave. And I don't want to say behave, follow the orders, but the reality is the things that we have been recommending for months, the face coverings, the physical distancing, at times social distancing, the avoidance of large groups, the frequent hand washing, certainly staying home when you're ill. Those are just basic public health, infectious disease, respiratory infectious disease recommendations that make a huge difference.
Yeah.
But if people, and it's a cumulative effect, it's not just one or the other. If I wear a mask, then I can get closer. If I don't wear a mask, then I have to stay farther apart. They're cumulative, and COVID-19 is exquisitely sensitive to behaviors. We've seen that, for example, when both Secretary of Health Weisman, followed by Governor Inslee, said you will have to wear face coverings in public. You will have to wear face coverings when you're going into any retail, any commercial enterprise. And we saw cases go down exponentially within the 2 to 3 weeks that we would expect a response. Pandemic fatigue, and people again aren't following that guidance. And I think it's one thing when people do it in public. I think, as you pointed out, Summer, it's when people are getting together on their own. It's when they're doing the parties in their backyard, the parties in their house. Um, and that's when, again, people who may be asymptomatic can be spreading an asymptomatic infection.
Yeah. What do you have to say to people who are still reluctant to acknowledge the science behind the efficacy of wearing masks right now?
I mean, you're not going to change ideology, Summer. You're not going to change belief systems. People, for any number of reasons, have come to discredit science, not believe in science. Um, Oftentimes, it needs to impact them before they get it. Um, but, it's really difficult to, if you will, change people's perceptions. I think one of the challenge, well, there's one of many, I think one of the many challenges that we've come up against is that, you look at the guidance Summer and it has changed. And it has changed as science has evolved around COVID-19. We called this the novel coronavirus, meaning we had never seen it before. We had nothing to compare it to. And what we had to compare it to, such as other cold viruses or SARS-CoV-1 or the MERS virus, this does not behave the same. So with respect to the face coverings, early on, some of the messaging was that the face coverings, well, we want to preserve them for healthcare workers, and they don't really prevent you, the wearer, from getting the infection. Well, we're all about ourselves and not so much about others. And as a result, people said, well, you know what? It's not going to prevent me from getting an infection. So why bother? Well, then the messaging changed and it became what we call a pro-social behavior, i.e., my behavior positively impacts you, your behavior positively impacts me. Collectively, our behaviors impact everyone. But again, as a sort of me society, my behavior, in this case, wearing a face covering, that, can be inconvenient. Some people don't like to wear them. Some people feel they can't breathe well, any number of reasons. Well, this does not impact me that much. And therefore, well, why bother in spite of the data, in spite of the research, in spite of the laws? And I think there's also just that pushback, the fact that there's laws now that say you have to wear them. Many people, especially those who, again, sort of are contrary to the public health messaging, say, you know what? You're not going to tell me what to do. This is an infringement upon my personal rights, and therefore I'm not going to wear them. I would argue that this is nowhere in the Constitution does it say that you have the right to harm somebody. And yet, by you not wearing a mask and you potentially being without symptoms but having the infection, you can potentially be harming somebody.
Yeah.
And the science is overwhelming. I mean, 6-fold decreased transmission by wearing a face covering. That's huge. It makes a difference.
Yeah. What is Spokane County doing right now to address situations where people aren't compliant with social distancing and wearing face coverings? Are people getting the cops called on them, or what is the situation with that?
No, I mean, enforcement is really difficult, Summer. So, again, in personal situations and neighborhoods and all that, it's nothing, no law enforcement is going to be wanting to weigh in on this, unfortunately or fortunately. But if retail, if a restaurant, if a retail site has been found to be, sort of quote unquote non-compliant, then we get complaints all the time. And we forward those to the governor's office. If it's a retail business, for example, they fall under labor and industry guidance. So as I said, there are ways of doing that, but locally, we don't have a lot of ability to enforce any of the state level guidance and requirements.
Yeah. Has that created any difficulties here, would you
Yeah,
say?
yeah. I mean, yeah. I mean, if you believe for any number of reasons that you do not want to, you don't have to follow a law, and you also feel as if there's no accountability, who's going to enforce it, then you're going to take advantage of that lack of enforcement. And so, again, I think people have taken advantage of it. People will continue to take advantage of it. And it's one thing if it's happening in a retail setting, And then again, I think things have changed pretty significantly now. I think a lot of retail, a lot of vendors, restaurants, bars are really good at getting people to follow the law. It's what people are doing outside of those spaces, in their personal spaces, that, again, you can never enforce that.
Yeah. One thing I have seen that really has bothered me is people being inside big stores like Costco or Safeway, and they wear their mask in, but then they'll take it off, you know? In situations like that, should people, shoppers who are concerned, just kind of
Yeah.
report to the management of the store? Or,
Or, again, we call them chin diapers, or, hey, your mask is droopy, when it's below their nose.
yeah,
And, yeah, I mean, there's little ways, if people feel comfortable saying something, hey, your mask is slipping, or, hey, something like that, to try to make them aware of it. And again, if you do it in a confrontational way, you will get pushback. If, however, you just sort of jokingly say, hey, your mask is slipping, or something along those lines, people, oh, well, thank you, Um, and then again, some people may be uncomfortable with that sort of mild confrontation. And then, yes, definitely talk with management, because again, management has to enforce it. And we have had situations where, because of lack of enforcement and because of multiple episodes of lack of enforcement, labor and industry has weighed in. And when labor and industry weighs in, it oftentimes will do so after education, with enforcement and with fines. And no business wants to deal with fines.
yeah. What can people in Spokane expect over these next couple months? The more I listen to the news, the more it seems like we are buckling down for winter and preparing for things to get a little bit worse here. Is that true?
Well, again, if we look into our crystal ball, we will say definitely we are very, very concerned about what the fall and winter brings for us, just because it takes us indoors. There was some speculation that COVID-19 would go away during warm weather. Um, at some point in time, when the virus itself becomes what we call endemic, meaning that it's always going to be with us. Right now, there are 4 coronaviruses that circulate and that cause colds. This will more than likely be the 5th such virus. But until it becomes endemic, meaning it's always with us, right now we will see that there's what we call no temporality, i.e., it did not get better during the summer. It actually got worse. Why? Because people got together. Outdoors is safer than indoors, but if you're still gathering and not wearing face coverings, you're still putting yourselves at risk. You're now going into cold weather where people are going to be hunkering down. They're still going to be gathering, unfortunately. They're going to be gathering with groups outside of their immediate family. 40 to 45% of people have no symptoms. So again, I think many of us are very concerned. Public health clinicians are very concerned about what the fall and winter months will bring. You may have heard in the news, Dr. Michael Osterholm said this past weekend that, the worst is in front of us. Scott Gottlieb, previous director of the FDA, said the next six to 12 weeks will be very concerning and possibly very bad. And you then have the cold and flu season. October 1st begins what the CDC identifies as the start of the flu season. So you now have COVID-19 plus all the other respiratory viruses potentially impacting us at the same time.
Yeah.
Yeah, we prepare for the worst, hope for the best. I mean, I do hope, for example, that, if people are able to continue to physical distance, if people continue to wear face coverings, they wash their hands, and those are all means by which you can decrease the spread of any respiratory infection. If everybody does that, well, then maybe it won't be as bad, but there's a lot of ifs.
Yeah. Um, I know a lot of people are kind of concerned about the vaccine when it does eventually come out, if it will be safe to take. So I wanted to hear from you. Are you committing now to taking the vaccine when it is available? And what do you have to say to people who are a little bit nervous about it?
Yeah, I think being nervous about it is not inappropriate, especially with some of the rhetoric that's been out there. I have been on 3 webinars in the past 2 weeks, two of which had Dr. Anthony Fauci on, and there is a process in place. It's a very, very regulated, strict process in place to ensure that the vaccines, when they become available, have again met certain criteria. The reality is that although the best estimates are that we will have enough information to say that one or two of these vaccines are good for a period of time to be defined. Again, we still don't know. The reality is that most of us will never see vaccines available to us until the summer or fall of next year because of the way that they are going to be prioritized for different populations, different groups. So we are very much involved in the conversation with the State Department of Health around vaccines, about how to both distribute them and how to communicate the safety of the vaccines. So we're all very much involved. We are looking at the data, looking at the science, and time will tell.
Yeah. So you think for the average young person like me, it won't be available till the summer, fall?
Yeah, easily.
Okay.
I mean, you know, you're looking at more right now, the two vaccines that are farthest along in their trials both require uh, 2 doses, so 1 month apart. And you're looking at millions upon millions, hundreds of millions of doses needing to be available to vaccinate everyone. So although if these two vaccines, the front runners, are found to be effective, you will see tens of millions of doses potentially available December, January, February. But again, to see mass production to the degree that we need it throughout this country, and then also you look at international needs, realistically speaking, your age group, me, a lot of us will not be seeing vaccines until the summer or fall of 2021.
I think that's definitely not what people hope.
No. Yeah, I mean, but it's the reality, unfortunately, Summer, I think, there has been a lot of, I want to say misinformation, misdirection. The last couple of months, we've seen this big focus on vaccines as being the silver bullet. And the reality is that that has, I think, at some level, I don't want to dispel the need for hope. Trust you me. I mean, I think we all need to hope that this will indeed end. But the vaccine in and of itself is not going to be the end all. And it's not going to be available come November the 3rd or December the 1st or January the 1st. And then you're going to have to prioritize a limited resource. And so the reality is that all of the public health messaging that we've been doing, Summer, for months, the face coverings, the distancing, the avoidance of social gatherings, hand washing, staying home when you're ill or feeling sick, those are things that are just basic public health recommendations, what we do during pandemics. They will be with us for months, if not a year to come. So even once vaccines become available, this guidance is still going to be essential because, again, we will still have COVID-19 throughout the community.
Yeah. And what advice do you have for people who are getting this pandemic fatigue a little bit, being stuck indoors, being online, maybe wanting to go out to the bar, but being nervous? What would you say to them?
Yeah, that's a great question, Summer, and I wish I had easy answers. I mean, I just case in point, yesterday, I joined my wife and a friend for cider downtown, and I felt really uncomfortable going up. Granted, you can't go to the bar, but just getting the cider because there were people inside, and there were people who were sitting close to each other, and they were well within the 6 feet of social distancing of concern. They were like 2 feet across from each other at tables. We sat outside, and we had our down jackets on, and um, Yeah, I don't have good answers and I apologize. I think it's something that, we have to understand that this is part of the new normal, and it's not easy because people want to return to normal. But this is our new normal for now. And the only way really we can get through this summer, if we're not going to continue to see huge spikes in cases, we can't we can't let our guard down. We have to really continue this. I know it's tiring, I know it's fatiguing, but the reality is that not doing it makes the situation even worse. And if we make the situation worse, then we may see more restrictions, and nobody wants more restrictions.
Yeah.
So it just has to be part of your routine. You wake up, you're going outside, you're going into, you put on your mask. Hey, you know what? I'd love to get together with you. A good friend of mine contacted me the other day, and she said, I think our last days of having a beer in your backyard are probably finished because the weather's too cold, and we'll have a virtual beer. Um, we're just going to have to realize that life is different now and live in the moment, but also acknowledge that, there is a future and we will see it. We just have to be present right now and understand that we have to do these things. Yes, they're inconvenient, but they're absolutely essential to prevent us from getting infected, to prevent us from spreading the infection to other people.
Yeah. I absolutely agree with that. Yeah.
You know,
Um,
Summer, you as a young woman, you would know best what kind of message is going to resonate with with people, with your peers. And it has to come. It's not going to come from this old white guy, this guy who's the public health official. People are bored of me. And I don't blame them. I'm bored of myself. But the reality is that this is stuff that we need to do, and it's a collective effort. It's not just me getting up behind a podium as I will in another hour and say, hey, this is what's happening. It's you talking with your peers. It's you saying, hey, I'd love to get together with you, but, or, we're going to get together, but you know what? We're going to do a little differently now. We have to be able to be functional and figure out how to make accommodations to live our lives. We can't hunker down indefinitely, but we have to be doing certain things that we haven't done before that are maybe perceived as inconvenient or uncomfortable. But that's where we are right now. We're in a pandemic.
yeah.
And to deny that is, again, going back to your first question, you're denying science, you're denying reality. And that's the only way we can really get through this, really following the guidance. The guidance is good. It's uncomfortable for some, it's inconvenient for some and others, but it really is what we need to do. It's our new norm. It's what we have to do to get through this.
Yeah, totally. With that in mind, what do you advise in terms of Halloween and Thanksgiving? Are you nervous that there's going to be a lot of
Yeah.
large gatherings or even small gatherings with potential for spreading the virus?
Yeah, I think, trust you me, we're messaging it right now. We're looking at, Department of Health, for example, that we work very closely with, is looking at how best message around Thanksgiving. Dr. Fauci came out last week and talked about how his Thanksgiving is going to be different. Are you going to get together with your extended family, aunts and uncles and brothers and sisters from afar? No. You're not going to be traveling to see your extended family this year. We strongly discourage that. So it's your immediate family. Maybe it's your social bubble that you've created over the past, couple of months. But again, it's going to be really limited. It has to be limited. Otherwise, you will see spread of infection. And the last thing you would want to do is to know that your Thanksgiving dinner or your Christmas event caused people to get infection. But that's very much the potential, because if I have, literally, imagine, if you will, 40 to 5% of people are asymptomatic. So every two people, okay, of that two people who have infection, one has no idea that they have symptoms. We have no idea, with as much COVID-19 as exists in Spokane right now, we have no idea who's infected and who's not. And what we're seeing, again, not only in Spokane County, but across the state, is it's those behaviors and it's family gatherings. It's families. Again, that's your biggest risk. If you're, again, you're spending a lot of time with your family members, you're in close contact, you're not wearing a face covering at home, you're certainly not following social distancing, and somebody brings infection into the house, and then everybody gets infected.
Yeah.
So be cautious around the holidays, definitely.
Um, so for people who, let's say, want to, like a college student that wants to go home and have Thanksgiving with their parents, what would your advice to them be? Are you just gonna say, be careful, like get tested and quarantine before you go, or just not go at all?
Yeah, I think you know, I think it's going to vary. I think suggestions are going to be, Gonzaga. Gonzaga, as you know, is going to essentially shut down for Thanksgiving and having conversations about what do you do when students go home. Are they going to test before they go home? Are they going to quarantine when they go home? Are they going to wear face coverings when they go home for a couple of days? They're going to be home for that extended period of time, with some exceptions. So I think we have to come up with strategies, and we work very closely with Gonzaga. We actually meet with them every week. And so that was part of our conversation yesterday on what kind of guidance do we provide to students on the campus who want to go home for the holidays. You will go home. I mean, the majority of students, as you know, will end up going home, who are on campus. Um, and how do we do that safely? So I think, again, there will be guidance, but in general, I think, yeah, you know, watch yourself, look at your own sort of risky behaviors. Have you been going to bars? Have you been socializing with people? What is your risk profile? And then weigh that with going home to seeing your family. Well, yeah, I did. Yeah, the last couple of weeks I have gone out to a party. I've spent a lot of time going to restaurants and socializing with my friends. I've not been wearing face coverings. I've not been following the distance. You know what? You're probably at significant risk. Do you want to take that risk home? Maybe you'd think twice about going home.
Yeah, especially with, it seems like there's a really high rate of false negatives as well, so that kind of creates a whole other issue in terms of getting tested.
Yeah, it depends. I mean, it depends. I mean, the whole testing issue is quite challenging. It depends on what type of testing you're getting done. Is it a rapid test versus one that's being sent out to a laboratory? There's a lot of ifs. Trust you me, and it's not cookbook by any means.
Yeah. What can people in Spokane expect in terms of any changes during these next couple months? Would you say that things are going to get more strict, stay the same, just kind of respond as cases rise, or what do you think?
Yeah, I think, for example, Summer, right now, the governor's guidance is around a lot of different sectors and different strategies to address, where risk exists. You may or may not know that the governor came out yesterday with new guidance for colleges, for universities, that would potentially affect college life for residents on campus. I think you will see the governor's office, Department of Health, local public health respond, hopefully proactively rather than reactively. I don't think that anyone is going to accept a lot more quote unquote restrictions, but I think we do need to look at where risk occurs and where problems occur. So if at the state level, the governor saw that a lot of college age students, especially in large public universities, were causes of outbreaks on campus, which then extended into the local community. That's why he came out with this new guidance. So I think that you will continue to hear from me, continue to hear from public health, that the basic guidance, face coverings, distancing, all of that will stay in place. And then with respect to different business sectors, I think you may see some minor changes here and there based upon either the data looking positive or the data looking negative.
Do you have anything else that you think that people in Spokane should know?
Well, I think, the take home message for me, Summer, is that 2020 has not been a good year. And 2021 is going to start off maybe also not in a good way. I mean, right now, I would have liked to have seen our incidence rate much lower going into the cold season. So I think, it's going to be hunker down, more of the same. I really continue to implore people to do the right thing to keep everybody safe, because it's not just individual behaviors, it's collective behaviors that can really impact the community, and support each other. I mean, you asked earlier about pandemic fatigue. How do you support each other? How do we all support each other collectively to get through this? We have to get through this. We will. It's taking its toll on people in many, many ways. But again, I think, we have a strong community. The community needs to acknowledge its strengths and how it can really work collectively to help everyone get through this, especially those who are most at risk. Our marginalized populations, our poor, just a lot of populations are really at increased risk. And we need to really acknowledge that it's a collective effort to ensure that everybody in the community is safe and can get through this pandemic together.
Yeah, that's great advice. I think we're all kind of struggling with that day to day, but we've kind of, at least I have kind of managed to get a routine down and
Yeah.
stay sane through everything.
Yeah. Yeah. I mean, again, routines are great. People, I mean, we live on routines and our routines have changed, but again, you come up with a new routine. One of the questions that, that Kelly shared with me was, well, what does your day look like? And my day is pretty routine, for the most part. I come in, I go to my epidemiology meeting, I have meetings, I have conversations, I deal with COVID-19, but I've got a routine. Routines help all of us, and our routines have had to change. But get a routine down, and also find what makes you happy. For me, it's trail running. For me, it's being outdoors. For some people, it's watching movies, it's reading a book. Find things that really make your life enjoyable, and maybe expand upon them. Maybe find something new. So maybe you've always wanted to do something. You've always wanted to watch this movie. You've always wanted to read this book. You've always wanted to read War and Peace, because it's only a couple thousand pages, however long. Find something. Joseph Campbell, years and years ago, talked about following your bliss, and find what makes you happy. Find what makes you happy. And granted, these are tough times, but there are um, pearls to be found. And last evening, for example, there's a group of faith leaders that get together on a regular basis, and they had a beautiful prayer service, and they asked me to participate. That was neat, and it was something that I wouldn't have given consideration to, but it was very meaningful. And there was a beautiful poem that was read at the beginning, and just some very thoughtful comments about how this is impacting them and how it's impacting their faith communities, and how we have to work together. Um, Find what works for you, but you have to find what works for you. Otherwise, this is going to be a lot harder than it already is.
Yeah. One thing that I've kind of started to live by is do one thing every day that makes you happy. So, like
You're
what you've been saying, expanding on things you've always wanted to do. I've been trying to read more, draw more, do things that I wouldn't even be able to do if I was in person with classes
right,
and stuff right now.
right on. Yeah, good for you. Good for you. And again, share that message with your classmates, and with your peers. You have to find things that make you happy, and especially in times that are not very happy. Otherwise, we'll just be miserable, and that's no way to go through life.
Yeah,
Yeah,
absolutely.
definitely find what makes you happy.
Well, thank you so much, Dr.
Yeah,
Lutz, for doing this
yeah,
interview. I really appreciate it. Where can people go to find out more or if they have questions about COVID?
yeah. Certainly, our website, srhd.org. We definitely have a lot of information, both information that we generate as well as other links and resources. So, if you're looking for COVID-19 related information, by far and away, look upon us as a resource. Lots of links and lots of information. It's very relevant to what's happening.
Great. Thank you so much.
You're welcome.